Live now, Rika?
Yes, I believe
Okay.
so.
Well, I can just do the introduction. So, good morning, everybody. Thank you today for being here for our PACE next or monthly PACE meeting. Today we're going to talk about diet again. So with me, I'm introducing myself. I'm Dr. Singh. I'm one of the nephrologists, board certified nephrologists at University of Wisconsin-Madison, and I see patients who have kidney disease and focus specifically on patients who have glomerular kidney diseases. With me, I have Tony here, who's the patient representative for our PACE group, which is the patient and caregiver engagement, and also have Rika, who's the administrative person who helps us make this happen, and then Dr. Poyan Mayer, who's the kind of the chief of GlomCon, who makes all this happen as well. So just a little bit. I think in the beginning, I kind of give a presentation for about 10 minutes just on the topic that we are going to talk about today, and then we'll do some Q&As after we are done with this presentation. So the PACE is a patient and caregiver engagement platform, and only patients and caregivers are allowed to participate in this meeting. This event is not to obtain, solicit, or share medical advice, but serve only for general educational purposes. And this event does not and cannot relate to care provided by the kidney doctors. For individual health or kidney disease related questions, please speak with your own doctor. And this is, again, just for your education. With that, I'm going to talk a little bit more about diet and kidney disease. And this is just continuing the series of diet and kidney disease. I'm going to go back to what we talked a little bit over last month and then add some new concepts as well. Again, because diet is such an important part of managing your kidney disease. So most of the data that I present, or most of the things that I present here, comes from KDIGO and some other studies, which are usually referenced in the slides at the bottom. But KDIGO is a global or international organization that gives kind of guidelines to the nephrologist all over the world, or kidney doctors and nutritionists, or people who are taking care of kidney disease patients with kidney disease. They give them guidelines to how to manage patients who have kidney disease. And there are obviously some guidelines about diet as well, which is where most of this presentation is from as well. So one of the first one that they talk about in managing kidney disease is a lot of lifestyle management, which is the first thing that they talk about when you that all people who have kidney disease should have risk factor assessment about what their lifestyle is and if it is appropriate, and then be counseled about following a lifestyle that helps their kidney disease. And the first one in that, as you can see, is healthy diet. So healthy diet plays a very important role in managing your kidney disease. So what is healthy diet and what specifically about kidney disease? It is, and the most important thing, if you ask me, would be with a high is changing your diet, making it more diverse, and having a higher consumption of plant-based foods compared to animal-based food, and lowering the consumption of ultra-processed food. So if there are two things from this whole presentation that if you can remember, would be increasing your plant-based foods and decreasing the ultra-processed foods, the foods that are made in the factory, and you don't find it on the plants, or that are processed in the factory and are man-made in a way. And so eating less of this, which is, as you can see, obviously all the processed food, which is your cola drinks, your candies, your pizza, and the burgers, the chips and the fries. These are essentially all the processed fruit. So eating less of that and then eating more of this, which is your plant-based diet. Again, eating more nuts, whole grains, more fruits, and more vegetables. And that's kind of more increasing the proportion of that in your diet is what it would be. Before I go into a little bit detail into the diet, I think one of the concepts that I do want to talk about is that they're dietitians that should be, or that exist, that help the doctors provide adequate education to people who have kidney disease, and they're called as renal dietitians. And because people with kidney disease have a lot of limitations as the kidney disease progresses, about not just sodium, not just protein, but also like phosphorus and potassium and fluids and other things. And that's what the goal of renal dietitian becomes, to individualize your diet, and that's what they are for. So that should be one of the things. At least I would encourage all people who have kidney disease to meet with the kidney dietitian at least once, who specializes in kidney diet or has been trained to do that. So who is a kidney dietitian? So registered dietitians, at least in the United States, need a bachelor's degree in dietary courses, and then they do a 1,200 supervised hours, and then they have a national exam that they have to pass. Somebody who's a renal dietitian, on the top of that 1,200 hours, does another 2,000 hours working with the kidney patients, and there's a second exam that they have to pass, and that is called, then they get the certification of renal dietitian. So they have a much more in-depth and detailed knowledge about working with people who have kidney diseases. Obviously, there are people who don't get board certified, but work with a lot more with patients with kidney disease, and they're called as renal dietitians as well. How do you find one? In the United States, National Kidney Foundation is one of the organizations that have a online portal where you have a dietitian directory. So you can go on the directory and find one based on your region where you live, and they'll have a list of all the registered kidney dietitian that they would be. They also have ways to figure out how your insurance is going to cover your visit with the kidney dietitian as well. And a lot of dietitians actually provide services via telehealth. So it does not have to be in your region, and you can essentially find somebody anywhere, because a lot of it is just talking and going over the diet and getting that on a video platform as well can be done. Going back to the diet, and if one of the other resources that I found is there is this Journal of Renal Nutrition. So there is a lot of, at least one of the whole medical journal that exists about renal nutrition, or renal nutrition meaning people who have kidney disease and what they should be eating. And in there, if you find, there is a patient kind of learning tools that doctors can use for their patients, and I really find them very helpful. So if that's one of the things that you would want to check out, there would be really good figures like these that can help you kind of reinforce, and you can print them out and put it on your refrigerator to find it. But it's one of the good resource for you to know for somebody, because they're a patient kind of in a simplified language that you can understand as well. So this is one of the good ones, and this is for anybody who has chronic kidney disease, and a nutrition tool to help to kind of what your food should look like in a day, or what your plate should look like. As you can see, about half of them should be fruits and vegetables, and among that, about a third, more than a third, should be vegetables, and then a small amount of them with being fruits. And then there should be some healthy fats here with nuts and avocados, peanuts, chia seeds, canola oil, then the animal protein. Again, it's not that you should stop eating animal protein, but as you can see, the proportion of your plate with the animal protein should be much smaller compared to the vegetables, even fruits, and even kind of similar to grains is what I would say, in the same proportion. And when you're looking at the animal protein, you can see a little bit bigger protein to the eggs, cheese, fish being a bigger part of your animal protein. And then even smaller with when you talk about chicken, turkey, pork, or any of those low-fat beef. So the red meats being a very small proportion. Again, not that you have to stop it, but just decreasing it significantly less. And then legumes. So again, plant-based proteins, increasing those. So legumes being, including them more in your diet. And then other starchy vegetables or grains being the part. Again, whole grains is how you get your carbohydrates, and then some starchy vegetables as well. And so this gives like a good pictorial kind of thing for you to kind of think about how much and what to eat as well. When going to protein, because I think this becomes an important part of the diet, in somebody who has kidney disease is to consider limiting a protein a little bit, which is about 0.8 gram per kilogram. So if you weigh about 60 kilos, then eating about 48 to 50 grams of protein and not going higher than that. And as you can see, for every weight, how much of protein, grams of protein that you should eat. We kind of talked about which proteins, and then when you think about which proteins, it would be more plant-based protein and animal-based protein in this way. As you can see, majority of plant-based protein here, and then fish and eggs, and then very small amount of these traditionally called as animal-based protein, which is red meat or chicken. Um, if it is not recommended as to cut down your protein to very low levels, that is less than 0.5 grams per kilogram. So if you weigh 60 kilos, you should not eat less than 30 grams, because then you can lose muscle mass and you can become weak and frail. So it is not recommended to go below that, and aim for somewhere about 0.8 gram per kilogram. If you go lower, you also don't get essential amino acids as well that you need for protein, for muscle building, and other things that you need to do in the body as well. Again, we kind of talked about which proteins to eat: animal protein and plant protein, legumes, beans, nuts, seeds. Whole grain cereals are again a source of plant protein, and some of the starchy vegetables as well have plant-based proteins as well, and then those animal proteins. How do you figure out, or some of the practical tips to look at, like how much protein is in one of the foods? A lot of foods have these nutrition facts. So when you are looking at the back of the food at the product label, it will say about servings per container. So it will say how many servings. So this food label had about 8 servings per container, and one serving is 2/3 cup. So you really need to focus on what the serving size they're saying. So 2/3 cup of whatever this was has these many nutrition facts. Today, let's say we're talking about protein. So 2/3 cup of this has about 3 grams of protein. And let's say if you're 60 kilos, you had to eat 40 grams of protein. So if you eat 2/3 cups of this, you'll had 3 grams of protein of whatever the substance was if you were eating. And that's kind of how you add up. Again, you don't have to do it every day. I think if you start doing it for the first week or so, and then we tend to eat, all of us, the same things, and you get the hang of it too, as to how much protein is in this amount of things. So you really need to focus on the amount as well of the things that you're eating, because it changes. Because if you eat 2 servings, if you eat 1.5 cups of this, then the amount of protein would be different in this substance of whatever thing that you were eating as well. Then sodium, after protein, sodium is one of the other things that you focus on when you have kidney disease. You want to keep the sodium below 2 grams. Again, how do you figure out how to go below 2 grams? Is going back to this, again, the label, and then just looking at focusing on the serving size. And then one serving size has, as they can see, 160 milligrams. Again, a lot of this percent daily value depends on a normal person. So this you might not, you sometimes don't go by this. Just figure out how much you're supposed to eat of the sodium, of the protein, and that's what your kidney doctor or your dietitian will tell you based on your level of kidney disease. And then you can focus on how much of the sodium is in this particular serving of this food that you're eating. Again, obviously, sometimes it's hard to calculate each one of that, but if you're more mindful of kind of doing that math for a week or 2 weeks, and then you will adjust and get the hang of it, and you'll figure out how to eat. So it's not that you have to keep measuring it each and every day as you go on, but it does take effort for about a week to 2 weeks, I would say, in the beginning, to be thinking about how much you're eating of the portion size, and how much of that portion size would have protein and sodium, and other things that you need to pay attention to in what you're eating in your diet. So limiting salt or sodium is one of the hardest thing, I would say, that most of my patients say, and I have tried to follow a low salt diet myself. It's really hard to do. So some of the ways, again, this is from the same journal, which have some of the patient kind of handouts, which is Journal of Renal Nutrition, again, a medical journal, so more geared towards the doctors and the dietitians, but they have these a column where they talk about patient resources, and they have really neat these resources or ideas that you can follow to cater your diet towards your level of kidney disease. So you really need to know what your diet needs to be and then find resources how you can make that happen, which is where this helps. So how to cut down the salt? They talk about enhancing flavors of your food without adding the salt, and that helps in making the food tasty, but not without the salt. One of the things they talk about is grilling or roasting, because grilling vegetables makes the caramelizes the sugars in food and intensifies flavors. You can add umami, which is like mushrooms, tomatoes, soy sauce, cheese. They can kind of bring that flavor without adding the salt, vinegar, some citrus or garlic and pepper. So there's just another ways of enhancing the flavor without adding the salt, or cutting down the salt but still keeping the food tasty. And that's kind of what your dietitian will work with you as well, and trying to suggest you ways to adjust the food to your liking, what you like, and still cut down on certain things that you would want to cut down, that you need to cut down with your level of kidney disease. And they kind of talk about other recipes that you can use with these combos, to cut down the salt in your diet as well, with egg adding garlic and chives, with vegetables roasting, with thyme and vinegar, as they've said, without adding the salt in them, so that they still taste really nice and not have that bland flavor if you don't add salt to it. Um, so I'm not going to go into salt with the kids, because I'm not talking about kids. But one of the other things that I wanted to talk about, this thing which is called as anti-inflammatory diet. So this is one of the diets which have been studied in literature or in medical literature, where they do studies in people to see outcomes of this anti-inflammatory diet. And there is actually probably one of the best studies diet after some of the studies of diet in kidney diseases is anti-inflammatory diet. Again, most of these studies are for general inflammation in your body, and have been studied in certain other autoimmune diseases. So autoimmune diseases is where your inflammation in your body comes from your immune system dysregulation, which is a lot of glomerular diseases too, like IgA nephropathy, like FSGS, like lupus, like vasculitis. So a lot of these diseases are autoimmune diseases. I will give a disclaimer that there are not a lot of studies, actually I couldn't find much, of specific anti-inflammatory diseases in anti-inflammatory diet in any of these diseases, but it's just has been shown to decrease the inflammation in overall in people who have a high degree of inflammation, and in certain other autoimmune diseases like rheumatoid arthritis, where they do tend to have a lot more inflammation. So there's definitely data that it decreases inflammation in your body. So if you have any autoimmune disease, this is one of the diets that could help, definitely. And it actually goes really well with the chronic kidney disease diet as well, because I think there's a lot of similarities, again, being increasing the plant-based foods and then cutting the red meat. But we'll go a little bit into detail about that. And so what it does, it helps in weight management, it improves your heart health, cardiovascular health, it helps with your blood sugar if you do have higher blood sugars, it improves your immune function, and then improves gut health, it reduces cancer risk, and these are all the things that have been studied. Again, not all of them have exactly direct linkage and bigger studies, but at least some data into each of these that I mentioned. And how that happens is it by decreases a lot of these cytokines, so the molecules in a body that increase inflammation in your body. It helps decrease that by decreasing the reactive oxygen species, and then activating the immune response, and then the whole cascade kind of follows it if your immune system is activated. So by having an anti-inflammatory diet, you decrease these reactive oxygen species, and then you kind of calm down your immune system in your body. Which obviously, when you have an autoimmune disease, we use a lot of medications to decrease your immune system or suppress your immune system, and this is one of the ways that people can decrease their immune system by themselves by following an anti-inflammatory diet. So what is an anti-inflammatory diet? So they kind of talk about certain components to it is omega-3 fatty acids, increasing that coming from fatty fish like salmon, mackerel, some flaxseed, chia seeds, walnut, and different fish oil supplements, and they kind of talk about what is the data behind and how do they work by decreasing your white blood cells and activation as well as your endothelial cells. So increasing omega-3 fatty acids, increasing your monounsaturated fatty acids, which is your olive oil, your avocado oil, your nuts like almonds and cashews, peanuts, sesame, and canola oil. And again, how do they do it? It improve insulin resistance, increase adiponectin secretions, and decrease those cytokines that make your immune system activated. Then the third thing that is important in anti-inflammatory diet is your antioxidants. And where do they come from? They come from a lot of fruits like berries, strawberries, blueberries, blackberries, and citrus. A lot of vegetables, green leafy vegetables like spinach and kale. And again, nuts and seeds, which are again have a lot of antioxidants, and turmeric and ginger. And they decrease your those reactive oxygen species as well. Then the other part of the anti-inflammatory diet they talk about is polyphenols. Again, these are all the components that together make the anti-inflammatory diet. So increasing the polyphenols in your diet, which comes from, again, extra virgin olive oil, your black and green tea, nuts, seeds, dark chocolate, legumes, fruits, red wine, vegetables, and coffee. And again, they have the anti-inflammatory and antioxidant properties. Then the next one is dietary fiber. Where do they come from? The whole grains, fruits and vegetables, legumes, nuts, and seeds again. And as you can see, there's kind of like a theme in all these because there's a lot of overlap in certain foods that they are found. The same foods have a lot of things that are part of anti-inflammatory diet. And then probiotics, which comes from your yogurt, kefir, sauerkraut, so a lot of fermented foods, pickles, and they help improve kind of your epithelial function and decrease the chronic low-grade inflammation. Some of the vitamins and minerals, again, from citrus fruits, berries, vegetables, nuts, seeds. Some low glycemic index foods like whole grains, legumes, and non-starchy vegetables. And then phytochemicals from turmeric, ginger, garlic, cinnamon. So kind of, as you can see, there's like a theme of it. A lot of nuts, seeds, kind of have a lot of things that have antioxidant or anti-inflammatory properties. Legumes is one of the other ones. Fruits and vegetables would be the other one. And as you can see, one thing that is not here is your processed food. So that's kind of the opposite of what we call as inflammatory diet, is that processed foods, which is your colas, your refined flours, so any of those prepackaged foods, the chips, the pizzas and the burgers. So those are called as processed foods because they have the things that are made in or pre-made in a factory and very, very processed and very different from what, as you see in these pictures, that is depicted here. And so taking those away and replacing them with these is what would be the goal of having an anti-inflammatory diet and taking that inflammatory diet away from your things. But when you're trying to do this, it is hard, it is not easy. And there are certain things and certain, not all the foods that work in harmony. So you really have to think about what you're eating because there might be some compounds in some plant-based foods that inhibit the absorption of certain other things. And that's where the role of dietitian comes in really important. Also, because as your kidney disease, at different levels of your kidney disease and your type of your kidney disease, the things that you need to limit would be different as well. And that's where, again, talking to your kidney doctor and a kidney dietitian, I cannot enforce it enough, would be the way to start the process of changing your diet, is talking to them what you need to eat, what you not need to eat, and then looking for resources to kind of tailor your diet in that way. And these are just the things that I talked about are just resources to help change your diet depending on what you would be, what would be the appropriate diet for you. With that, I think that is all I had for today. And then we'll do some Q&A now.
Perfect. So the first question we have, Dr. Singh, is with a kidney disease but normal blood pressure, how important is it to go on a strict low sodium diet? And how much sodium intake would you recommend per day?
Perfect. This is a great question. Again, it talks about how to tailor your diet for what level of kidney disease you are. And so it's very different for different people. And again, the things that I talked about are generalized for everybody. If you do, even if you have kidney disease and somebody has no hypertension, it is recommended to do anyone who has kidney disease to do a low salt diet. Again, there are different types of kidney diseases, so it would depend upon which type of kidney disease you have, which stage of kidney disease you have, and discussing it with your kidney doctor to see if what amount of sodium that you it is recommended specifically for you. So I cannot comment on that, but usually people with kidney disease, even with normal blood pressure, to help their kidneys, it is recommended to do a low sodium diet. When we talk about low sodium diet, we are talking about close to 2000 to 2500 milligrams of sodium in a day. So that's kind of the amount of sodium it is recommended, even with somebody with normal blood pressure who has kidney disease.
Tripti, I have a question,
Yes.
and how you approach this, with kidney disease patient, there is a lot of, you see in the literature that potassium is good, it brings down the blood pressure, it may decrease A1C, it's overall an important electrolyte, but at the same time, we tell patients with kidney disease to avoid potassium. So, what is your approach to that?
Yeah, again, a great question. Again, which reinforces, I think, which is kind of the theme of this discussion we are having today is discussing your diet and individualizing to your level of kidney disease and having that discussion with your kidney doctor that if you need limitation in certain things as in your diet, because not everybody with kidney disease needs to limit potassium in your diet. And so if and that's when checking your levels and discussing it, looking at your potassium levels, discussing it with your kidney doctor, and seeing if you even if you need potassium limiting in potassium in your diet is needed or not. So if somebody has their potassium level within the normal range and their kidney disease is not advanced, then you don't need to limit your potassium. In somebody who has advanced kidney disease, and even if their potassium is normal, which happens sometimes, then they don't need to limit potassium. And if they want to follow a little bit high potassium with diet, which happens to be a lot of fruits and vegetables, then maybe checking your levels again, discussing again it with your doctor, kidney doctor, to keep a close eye on your potassium levels, and keeping a close eye to yourself and kind of guiding your diet on that way. But again, the most important thing is again individualizing, and not anyone who has kidney disease needs to limit potassium in your diet. One of the other things talking about potassium, as you said, high potassium foods, a lot of the foods that we talked about that somebody with kidney disease should eat. So lots of fruits and vegetables, lots of greens. They tend to have high potassium. Nuts, sometimes some of them tend to have high potassium. So there are things that have high potassium that it's hard to limit, and some of the medications that we use to treat kidney diseases tend to make tend to make the potassium levels high. So fortunately, we have more medications coming out, which sometimes I use for people to follow if they want to keep with the high potassium diet, to use medications to control the potassium. Again, it's that having that balance and discussing and having that say decision making. And some people say, I don't want to add more medication. Some people say, I'm okay with adding a medication, but I want to follow a high potassium diet because that is an anti-inflammatory diet, because otherwise I cannot eat things which I like, which are good for me. So again, having that discussion with your doctor and your dietitian combined, and getting a plan for you, which you can follow, would is what I would recommend at this point of time. Yeah.
All right.
I see there's a question in the chat, and also in that same line question. So that comes often. I see that often with also with my patients. It says, question during relapse, like, patient has a relapsing disease, relapsing FSGS, relapsing lupus nephritis, or relapsing IgA nephropathy or minimal change disease. relapsing nephrotic syndrome, all these relapsing immune diseases. Should diet be changed in any way? And in line of the same question is there any diet that can help control autoimmune disease like lupus, like FSGS? Can we use diet to affect these autoimmune diseases?
So great question. So I think the question, getting to the first question, should the diet be changed during a relapse of these autoimmune diseases? Again, a lot of these autoimmune diseases, when we're talking about glomerular diseases, during a flare, you have inflammation in the kidney, and that makes you leak protein and more protein in the urine and more blood in the urine, and that causes that swelling. So it is, we talked a lot about sodium and restricting the sodium. It is during these relapses that it is really important to decrease that sodium in the diet, especially when you're relapsing, because that's what causes that increased salt retention. Because at that time, when you're relapsing and spilling extra protein in the urine, you're higher likelihood of your kidney would want to keep back excess of salt, and that's how kidneys work. So it is really, really important during that times to follow that low sodium diet when you're relapsing. At that time, you're also losing a lot of protein in the urine, and that's just the some of the disease. When you have inflammation in the kidney, you lose that protein in the urine. And so during those, if you're losing protein in the urine and your protein levels in the blood are low, at that time, it's probably not recommended to follow a low protein diet like we talked about. So it's not recommended to go at zero point 0.8 grams per kilogram, because the most important thing should be that your protein levels in the blood, we want them to be normal. And obviously you're losing that excess of protein until the medications work, and your relapse kind of gets into remission. Till then, you should actually increase that protein in the diet, and again discussing that with the doctor about how much of protein you're spilling in the urine, and compensate about a gram to gram or a little bit higher than that to get your protein levels in the blood a little bit higher, because that's what causes a lot of symptoms as well, with the swelling and the higher blood pressure. So during those flares, it would be a little bit different diet, and that's again discussing with your doctor as to what the changes in the diet would be needed, which again reinforces diet is very personal and individualized. And so obviously these are general recommendations, but again discussing the most important thing about individualizing it for yourself, and what you need is what you get from talking to the doctor and the dietitian when you go. Getting to the second part, which is a harder one, I would say, Ali, would be what diet, or how can you prevent these flares? Like I said, there isn't a whole lot of data when we talk about data. Data meaning there isn't a lot of studies which say you follow this diet and this will lead to decreased number of flares. There is data that these diets, especially these anti-inflammatory diets, which is what we talked about, these components of anti-inflammatory diet, essentially more nuts and seeds, more fruits and vegetables, decreasing processed foods, and whole grains. So these kind of the four principles of anti-inflammatory diet, right, I would say. It has been shown to decrease the inflammation in your body overall. Has these been shown to decrease the flare? I would say the data isn't that strong. Like I can't say that, oh, you follow this diet and you will not definitely not have a flare. I wouldn't say that would happen, but the likelihood of you having a flare is, I can say with some certainty to my patients when I'm saying that it is much less compared to if you're eating processed food and inflammatory diet. That there's higher likelihood that your immune system would be a little bit active at baseline, and so slightly higher likelihood of you having a relapse. Saying that it will also make you feel better if you're having an anti-inflammatory diet, especially with some of the systemic diseases like lupus, vasculitis, sometimes even IgA. You tend to have less systemic side effects, or less like aches and pains, and less um, signs and symptoms, I would say, even when you're not having a flare. So that's kind of prevention of flare kind of thing is what I can say. I don't know if you had anything more to add. I know this is a tricky kind of topic, I would say, and it's really hard to do the studies for diet just because it's really hard to follow a certain diet and follow people. And diet is a long process. It's not like medication that you give for a month and you see the effects, or 6 months you see effect. changes with diet take years and years for you to see actually and study them. So it makes it harder to do the studies with diet changes as well.
Yeah, absolutely. That I think, understanding the effect of diet on health, like in a very comprehensive way that we want, is like the holy grail of medicine. And unfortunately, we really don't know it that well because there's no randomized clinical trial for it. We have not randomized patient to take this diet versus this and then compared. It's all from some cohorts and experiences, and so it not controlled studies, so it's very difficult. I think, yeah, my recommendation to patients is always, avoid processed food. When you avoid processed food, you already eliminated so much potential badness, like the salt and the inflammatory component and like the unnecessary exposures to things that are man-made and not natural and so on. And it also has other, beside immune effect, other benefit that when you avoid processed food, you tend to eat less because you need to cook it and you need to prepare it and they tend to be less calorie dense and so on. So the more you make yourself, the better. But yeah, I have read um, that sometimes garlic may trigger lupus flares. I actually read it on uh,
Mm.
some serious to take websites. So, but then again, I don't know what the studies is. It seems to be more anecdotal or not. The question of can dairy trigger FSGS, minimal change, and so on. They are there. But yeah, there is a gut kidney link and gut immune system link, but we don't know how to control it.
Yeah, which is coming in a lot of diseases about gut microbiome. And a lot of this, as you were saying, the inflammatory diet, which is, or processed food, what they change is not just that moment, but they change the microorganisms in our gut. And that's kind of where then it affects all the other organs in our body over time. So as you change your diet from processed to unprocessed food, you over time you're going to change. The other thing I want to reinforce before we go is, like, I tell my patients or people just overall and myself, and I follow it too, is it takes a little while. So it's not that you have to change everything on one go. It's just systematically and do at a time. And it's okay if one day you wanted to eat a pizza and you ate it. It's totally fine. So it's really hard to follow, but just being kind of gracious to yourself. And if you had a day that you went out and enjoyed with your friends or family, it's okay to eat. But then it is a lifetime kind of the lifestyle that you have to follow. So it's more sustained and over time is what you want to get at, which I think is being gracious to yourself at certain times. It's how it would be more sustainable.
Yeah, completely agree. What is your take on paleo diet or low carb diet or zero carb diet or the keto diet?
Yeah. Again, I think I obviously not a dietitian, but what my take on everything is has to be balanced. So I don't think there's any benefit of completely ruling out carbohydrates from your diet, but getting the right type of carbohydrates with whole grains and doing that is what would be helpful. Again, there's not much data. It's really hard to find the data based on this and specifically kidney diseases. And a lot of, I would say, some of the data exist in following these diets, specific diets that come what we call as they become really kind of famous on media and gain momentum on things of these. I don't want to call them fad diets, but diets which people really want to follow. So I don't want to give them a bad name because people are trying to make themselves healthy, and that's why they're trying to find the diets which they think might be healthy. I think it has to be a balanced meal, and that has to have carbohydrates, and because that's where we get the energy. But can our body make energy energy from fat? Totally. Can we make it from protein? Totally. We can burn protein and we can burn fat to get it, but that's kind of not how our bodies are. So I would say you do need carbohydrates, proteins, and fats and fiber. In proportions that it should be. So ideally, that's what it would be recommended, is what I would say when I talk to dietitians, is you need all parts of it. Again, it's also, the data is that it's hard to follow these diets for a really long time. And people who follow these diets, specifically, a lot of it is in weight loss, is where this data comes from, that they are able to lose certain weight, but then they're not sustained, because as they go back to their original diet, once they stop following this diet, they gain the weight back. So again, a lot of changes in the diet is to find the diet that's sustainable, that you can keep over time, which is practical, and you can follow over your lifetime. And doing them short periods, like 6 months or a year, because that is a short period for a diet to be followed, is not sustainable, I would say. So that's kind of my take on these specific diets when you look at, but yeah.
Great. Thank you so much, Tripti. I think that was a great session. Do we have any other questions, Rika and Tony?
No, I don't see any other questions.
Yes, all cleared.
Great. Awesome. Thank you so much, Dr. Singh, for another excellent session on the GlamCon PACE program. When is the next one scheduled?
Yeah, thank you. Our next PACE program would be on April 13th.
Yeah.
So that is our second Sunday. So just reminding everybody, we do it on second Sundays. I'm based in Chicago area, so it's 11:30 my time and 9:30 the Pacific time is when we start, when we have these. For this one, there would be a recording available that can be watched later as well, in portions of it if you want to.
Awesome.
So next time, if you have any suggestions, you can leave in future PACE sessions. If you want to see a particular topic, you can obviously leave it on our website. And then we'll put the link to our website in the chat over here, so you can see where our website is. But any questions, specific questions that you have for me, or about kidney diseases, or any other area that you would want to learn more about. Is it more treatment? Is it more disease? Is it more pathogenesis? How diseases happen? We can more than kind of take that feedback into account and work on future PACE sessions. But thank you, everybody.
Wonderful. Thank you very much.
Thanks, guys.